Good morning, everybody. We're just going to give it a few minutes to allow colleagues to join the webinar, and then we'll get started. Okay, I think we'll make a start. I know we're expecting one or two more people to join the webinar, but in the essence of time, I think we'll get started. So welcome everyone to this morning's webinar, where we'll be providing an introduction to the training that's available through the Food Active Network to support community food providers increase access to healthier food and drink. Just before we formally begin, if I could just briefly run through some housekeeping. We do have both the chat and the Q&A function enabled this morning, but I think because we're a relatively small group, if we could utilise the chat function throughout, that would be helpful. So please could I ask for everyone that's joined the session to introduce themselves using this function, perhaps just provide the name and the organisation that you're representing this morning. The webinar will be recorded so that we can circulate this to those who are unable to join us. As I say, we will have an opportunity for questions throughout. There'll be an opportunity following each presentation to put your questions to the speakers. So again, please do use the chat function for any questions you might have, and we'll monitor those as the session progresses. If we could ask if you could keep your microphones muted and cameras off unless speaking, but obviously during the Q&A, please do come off camera and microphone, and the slides and the recording will be circulated after the meeting today. So just some background to today's webinar. This is an opportunity to bring together quite a number of stakeholders from across the Food Active Northwest network, predominantly colleagues working in public health, but also colleagues who are working across food partnerships and within community food settings. And this is an opportunity to explore how community food support is evolving, particularly beyond emergency food aid, and the opportunities that this creates to improve access to healthier food and drink. So we'll be running through how our training and resources can support this, along with one or two guest presentations, and I'll just come onto the agenda shortly. I think we had around 40 people registered for today's event. I think we've got about 30 on the call, so that's really great. Thank you for joining us. We hope you find the session of interest and useful in terms of your roles going forward. I think most people on the call are probably familiar with the Food Active programme, but for anybody who is less familiar, just a little bit of information about who we are and how we work. We're a programme of work, a regional programme of work, originally launched back in 2013 by the Northwest Directors of Public Health. And this was in response to concerns about the increasing prevalence of children and young people in particular who are living with overweight and obesity and the associated disparities. So we're currently commissioned by 21 of the 24 local authorities across the Northwest region. We're part of the independent public health charity Health Equalities Group. And in terms of the Food Active programme, we offer a collective voice for our network and also a forum for learning and discussion. But our overarching aim is to advocate for local, regional and national action to promote healthy weight and address health inequalities. Again, just to cover off our core objectives, one is around influencing policy locally and nationally pertaining to healthy weight. So in terms of national policy, our role involves a number of advocacy activities. And in terms of some of our local and regional work, this is around developing a number of policy tools to support local authorities and partners. We do have a role around developing research and strategic partnerships. So this is to build the evidence base in terms of our core policy calls and our advocacy efforts. An objective around shared learning and knowledge transfer through facilitating events such as today and communications. And then finally, an objective around providing training, resources and campaigns to add value and capacity to the work of local authority public health teams. So essentially the training that we'll be providing an overview of today sits within that core objective. Thanks. And then finally, just from myself, just to briefly take you through the agenda for the webinar this morning, we'll be receiving a guest presentation from Lucy Antal, who is Director at Alchemic Kitchen. Really pleased that Lucy can join us, and Lucy will be providing an overview of how we can create access to healthier food and the importance of reducing inequity to healthier food across our communities. Abby, who is Project Coordinator at Food Active, I'm sure many of you know, Abby will be taking us through the training in terms of how it's being developed, piloted and disseminated. We're also joined by Amy Holbrook from Warrington Foodbank, and Amy will be sharing some of her experience in terms of receiving the training and implementing changes to community food settings in her area of work. And as I say, each presentation will be followed by an opportunity for questions, and we'll close the webinar at 12 p.m. So if I could invite Lucy Antal to join us and give your presentation. Thank you, Lucy.
Thank you very much. I hope everyone can hear me. I sometimes have issues with Teams. It doesn't like my Mac. And also apologies to anyone who's seen this presentation before. Chloe's going to very kindly move it on as I go because again, I can't work it on Microsoft. So I work for Alchemic Kitchen. Alchemic Kitchen is a project that grew out of working in Knowsley in particular, alongside some colleagues who've gone on to do great things, Keenan, who is now head of Feeding Liverpool, and also a group of people who are working in and around the community around food access and also running and supporting the Queen of Greens, which is our mobile fruit and veg van. So I'm just going to take you through a bit of a background. So if you wouldn't mind doing the next slide, please, Chloe. Thank you. This is what I always say. And again, as I say, sorry if you've heard this from me before, but everything is very much connected, and food I always think of as being a building block of life. And if you don't eat well, you won't learn well. If you don't learn well, you won't earn well. And I sat through a presentation from Public Health Liverpool last week, which was about healthy weight and about also the issues facing children in the region. And it was quite horrific to hear that children are suffering with stunted growth in our region, and that is something that can be directly related to and find a correlation between what they're eating in their early years, which to my mind then brings us back to this issue of access. Next slide, please, Chloe. So I'm going to focus a little bit on Knowsley here because this is an area that we've worked in, and it's an area that we had the University of Liverpool do a study on, which is where we discovered that irrespective of your income or your location within the borough, 70% of residents could be classified as living in a food desert. And what we mean by a food desert is somewhere where it's not easy for you to access fresh food on foot within a small radius of where you live. And for an awful lot of people, you are needing to get public transport or you're needing to use a car to be able to get somewhere where you can buy something other than vapes, sugary drinks, chocolate, etc., which seems to be the default for what goes on in lots of our neighbourhoods. Next page, please. So we've also got this issue around food aid. It's become normalised. I remember reading studies on this back in 2010, which was when it was sort of being mooted that, you know, this could go the same way as North America, whereby it had really become normalised and was part of some people's everyday kind of living. As you can see from the figures there, we've got over 3 million people going to food banks. And while I am not here in any way to say food banks shouldn't do what they do, because they need to exist and they have to offer what they offer, sometimes the food that is available through those food banks is not of the highest quality, which is to do with the fact that so much of it gets donated or is considered to be surplus. And because it originally started out as an emergency thing, the fact that it's become normalised and we've got people visiting food banks weekly, of which I can attest to from reports I've had from people in Stockbridge Village, for example, it's not emergency anymore. It's literally like the weekly shop, and that is definitely an issue. Next page, please. This was a report that I contributed to with Foodrise, and this was about what gets dumped into food banks. So this is where I'm getting my information from about the quality of the food that ends up in those food spaces. And this was actually researched by talking to people who are volunteering or running food banks across the UK, and it was also delving into the issues around the emotional issues that they face when they're given not great quality food by supermarkets or other retail options, where things are donated that frankly are not fit for purpose, are coming in with a really short shelf life, or are quite often sort of random. And I'm sure anybody from food banks on this call will recognise this if I say to you some of those random weird cheeses that you get at Christmas, where it's like, after eight flavour, and everyone's like, what am I supposed to do with this? So the issue for us is about how we can move people away from having to rely on food banks. And really the way to do that is to improve how we access fresh food. Next slide, please. So this is a bit of utopia thinking. I'm coming at this from wouldn't it be lovely? I do appreciate, though, however, this is not as easy as it sounds, but it would be good if we could look at some way in which we could work on a more human scale, and that we were thinking more about the fact that you need to live your life, not just survive your life. And at the moment, too many people in our region are surviving, hence my mention of emergencies. But this is also this idea that, you should be able to have the third spaces, which is the libraries, the community centres, health centres, gyms, etc., should be available in your immediate area to reduce social isolation. You should be able to walk and get fresh food from your local shop. It might not be the widest range, but there should be something there for you. And you should also be able to access being able to do some community food growing or a green space or something that generally is going to make you feel a whole lot better about where you're living and how you are growing up with your families. Next slide, please. This is also one of my many tropes, which is about the fact that we need to involve community far more in our consultation and discussions. I've done a piece of work with some European colleagues where we went and asked questions about what people actually wanted in their near neighbourhood. And I'll confess, I went into those conversations with the assumption that the people I was talking to would say, oh, we want a supermarket. And what actually came out of that conversation was, no, they didn't want a supermarket. What they really like is somewhere where they could get fresh bread, because a bakery was seen as something that was really essential to their neighbourhood. And they wanted to be able to get a loaf of fresh bread in the morning rather than have to rely on white sliced or go and get something that's not as nice from the local shop. So that's what I mean when I say you need to have those conversations. And sometimes those conversations take a while. So you have to allow the time to develop the relationships. Next page, please. So obviously, one of the things that my organisation is keen to support and also to campaign on is this idea of all children should be fed. It shouldn't just be predicated on your family's income. It should be every child is given a good fresh meal in-house, in school, every day. It reduces the stigma if you're feeding everyone, and if you are sufficiently wealthy to be able to support the programme, then please, for goodness sake, pay into it. But it should be made something that's mandatory and comes with all the requisite food standards that goes with it. We did a small experiment in a Knowsley school, which we called Toast, and that was where we managed to supply really good quality bread from Jackson's of York for a year for the children who were coming into school to be able to get a piece of toast first thing in the morning. And we had the University of Leeds who were looking at the data that came out of this, and it showed, interestingly enough, that boys from, relatively reasonably resourced backgrounds, so it wasn't necessarily the poorest of children, benefited hugely from the fact that they were getting a bit of toast, which was wholemeal bread, and it gave them energy and the ability to focus far more on their lessons than when they didn't have it. So that to me is an example of how it needs to be every child, not just one or two of the ones that haven't got the family support when it comes to money. Next page, please. I'm whizzing through this, so I hope I'm not going too fast for everyone, but I'm conscious of time. So this is how we started with the Queen of Greens. This was the original Big Apple library bus. Really thrilled when they're able to feed their children well. It's always just a case of making it easy for them to do so. Next page, please. This
it's a wraparound support. So that's the idea that, of course, as we kind of know, not having food is not the person's problem. It's a symptom of, you know, a whole plethora of things that might be there. So for us, I think if we were giving away food or selling